undergoing any type of clean contaminated surgery were included. The patients were very similar with their demographics prior to surgery, and they randomized them in a one-to-one fashion to either get ChloraPrep or Betadine in very large numbers, over 400 patients in each of these two groups, so much larger than the other two studies I presented. And this really summarizes their results here. And so this is looking at the proportion of patients with surgical site infections. And what you'll see if you just look at any surgical site infection, the infection rate was 9.5% in the chlorhexidine alcohol group, but 16% in the povidone iodine group. All right, so significantly better, a lower infection rate with chlorhexidine alcohol than betadine. And then they actually broke it down by superficial and deep infections. And in the chlorhexidine group, the superficial infection rate was 4.2%, and it was 8.6% in betadine, so twice as many superficial infections in the betadine group. And if you look at deep incisional infections, which are obviously the bigger problem, 1% infection rate with chlorhexidine, 3% with povidone iodine. So these were all statistically different, with chlorhexidine being more efficacious than betadine as far as preventing surgical site infection. So they found that the application of chlorhexidine alcohol reduced the risk of infection by 41% as compared to what the most common practice, at least in the U.S., is of using aqueous povidone iodine. Again, that's the p-value shown here. And since 2/3 of the surgical site infections are confined to the incision, they said that optimizing skin antisepsis before surgery could result in a significant clinical benefit. Now the next point is actually the most interesting one to me. They calculated the number needed to treat. And what they found is that if you treat 17 patients with chlorhexidine alcohol, as opposed to betadine, you're actually preventing one infection. So it's a pretty small number if you think about the number of operations that are performed in your hospital every year. And they found that the preoperative cleansing of the patient's skin with chlorhexidine alcohol is superior to cleansing with povidone iodine for preventing surgical site infection after clean contaminated surgery, and that's right from their paper as well. So in conclusion, I'm just going to quote Dr. Richard Wenzel, who's at the Department of Internal Medicine at Virginia Commonwealth. He said, "The weight of evidence suggests that chlorhexidine alcohol should replace povidone iodine as a standard for preoperative surgical scrubs." And I think I would agree with that. I've tried to show you some of the evidence here tonight, and there's just more and more coming out. So I think that chlorhexidine alcohol is clearly a superior agent, after reviewing these works. So thank you for your attention.
Thank you very much, Matthew. How many people here think they might change their behaviour on the basis of what they've heard in this session? Excellent. You're already doing it. How many people are aware of that evidence already? Okay. How many people, was it an update or something new? Good. We've got time for a few questions. Who wants to kick us off? Yes, this gentleman here, hasn't he? Tell us who you are.
Rami Hussain from Basildon. A comment on